New research suggests that 2 billion people in Asia and Africa could be at risk from a possible outbreak of Zika. As a precautionary measure, the Philippines has issued a travel warning for its passengers heading to Zika-infected countries. Zahora has more on other countries vulnerable to the virus.
People in India, Indonesia, and Nigeria are among the most vulnerable to Zika virus transmission. That's according to a team of researchers from the London School of Hygiene and Tropical Medicine at Oxford University and the University of Toronto. They base their predictions on data obtained from people who have taken a flight recently from Zika-affected areas in South America to countries in Africa and Asia with a history of diseases transmitted by mosquitoes.
The situation continues to constitute a public health emergency of international concern. And this is because new outbreaks of Zika continue to be identified in new geographic regions. For example, there was an outbreak identified in Guinea-Bissau and another in Singapore.
Countries with a high number of people coming in from the Americas are at most risk. So are those with limited health resources, like the Philippines, Vietnam, Pakistan, and Bangladesh.
In Singapore, because they have an extensive, a very highly technical health system, very technologically advanced health system, they've been able to identify it very early. But in other countries where it might enter at some time, that might be the case. And so there was much discussion among the committee and with the Secretariat about being sure that there was special emphasis put on appropriate guidelines and appropriate guidance and technical support to the lower resourced countries.
But researchers are still not certain whether some people in Africa and Asia may be immune to Zika.
We know that the virus was in Asia and Africa before it was in the Americas. The question really is whether that previous exposure provides the people of those two continents with any immunity to the virus, so that as it travels back from Brazil via international air travel and so on to the Asian and African continents, will we see outbreaks such as we've seen in Brazil, or will it fizzle out because the population's already immune? We don't really know that yet.
More than 65 countries and territories have reported the virus, and Singapore is dealing with the first outbreak in Asia. Scientists say the mosquitoes thrive in summer when they're able to live longer, but much else remains unknown, including the details as to exactly how the virus spreads. But with this research, we may at least now know where it could spread. Zahora, TRT World.